basically drops down, and it's a really low impact, low force way of adjusting something. If someone's pretty sensitive, I like to use it for pelvis. Some people don't use these at all, and that goes into the whole idea that every chiropractor is very different. And so this is a portable one. Not every table, especially at the clinic, has those drops. We have some for the pelvis. Every table has pelvic drops, like we for down here, but like ones for up here, mid back, low back. Not all tables have it, so I can slip this guy in there on any of the other tables besides Dr. Bob's table, and you got a drop. Next, chiropractors, I've talked about this before, are portable injury providers. So people can come in with, sprained ankles, but also ear infections and, things like that. And what this equipment is I usually use it more for looking in ears. It's an otoscope. I do have an ophthalmoscope there, but I usually don't get too many eye conditions. So basically, you just put a little spiculum in there, a little plastic piece to protect the ear from infection and things like that. And you go ahead and look in there. Usually it's kids. I've looked at a lot of adults' ears too, and you can spot an ear infection. If it's on the minor side, yeah, you can use a wait-and-see approach, but you can also get them referred to the medical doctor if they were to need antibiotics or something like that too. So Dr. Tracy, she had borrowed last night, so she had a little one with ear stuff going on, ear infection stuff. So it's it's not something that's often used, but it's nice to have, and we have a few of these in the clinic. Another thing here, this guy here, some of you may have seen this, some of you, well, most of you haven't. This is called an activator tool, and it's an adjusting tool. And so you can basically set this thing for really pretty forceful or basically next to nothing. It's good for babies. You can basically have such a low force on there. It's really gentle and really specific. And for adults too. I like to use it on the Atlas, which is hard to get to. It's really small, pull underneath the ear, first segment of the spine, and it's a nice tool to have in our tool belt. There's also a whole protocol that goes with activator, another technique. So some people only get adjusted with that. I don't like to use it as a primary adjusting tool. Most people don't like it, but I've had people, especially from Illinois, come up. Maybe they're up for the weekend at their lake house or whatever, and Boston, I used to have it. Yep, I just need to activate it, and that's all they wanted, And so we have it, available for those situations. This guy here, you may have seen this too. This is a massager. It's pretty high. A lot of force behind it if you really want it. Otherwise, it's pretty gentle, adjustable. I use this on some people who are kind of tight and it's harder to move their joints. Muscles, if they're really tight, things aren't going to want to move as much. So we go ahead and maybe do that for 30 seconds to a minute. We can do it longer if people really like it. Someone will mention to me, yeah, it feels great. Well, I'll do another minute, So, we have a few of these in the office. We do sell these too. I've had a few patients that are like, yep, I want to get one. I love one. And they're on the pricey side. They're over $200, but they are really durable. I had one at my last clinic. Every patient I used it on about for 2 years, probably 20,000 times I used that thing, and it was still just as good as the day that it came in. All right, this guy here, I might have brought this last time too for extremities, adjusting knees and things. I don't think I went through too much extremity stuff last time, but this is a toggle, and what they're designed to do is they're for, again, kids. There's another technique called toggle where really all you do is drops. You adjust people's necks with drops. You adjust them right on here, lay them on their side. Well, you can lay an adult on their side, their neck right on here, or babies. I don't use it for babies. I use it for knees. So someone would lay on their back, and I'd set this guy. So just like that big piece, it's a smaller version. And so you can set it for really strong. If someone puts a lot, if they're laying on their back, there's a lot of weight on their knee. And all I do is just get real general motion into the knee. And most of the time, our joints, all they want is some motion, some mechanical input. They get really good at sensing whatever you give them most. So if you're really inactive and not, you don't get a lot of motion in a joint, they get really good at sensing pain. And that's how you get a lot of people with chronic pain they don't exercise or they can't move because it hurts, well then it hurts more because they're not putting, giving that good input in there. This is something that can help people with just general knee issues, not necessarily specific, just subluxations or where things are moved out of place, but a lot of times arthritis or arthritic knees benefit really, really well from this. So just a real general adjustment. It helps most people I've used it on. It's really beneficial. Following up on soft tissue and how things get kind of hard in the muscles and it's hard to adjust. This guy is called a nabble. So it's for softening up, doing some trigger point therapy on some things, and really just non-specific again, just kind of trying to loosen people up a little bit so that the adjustment goes easier. It's got a large end and a small end. Small end can be pretty intense, so most people, it's just a little force, a little bit of force behind that large end, and it's pretty comfortable for them. How's it going here?
Oh, 5 minutes. Yeah, well,
4 minutes, all right. Great. I might have a...
Still got time.
I might make it through everything.
Still got time.
Tuning fork. So again, with portal of entry provider, meaning someone might have a broken bone and they come in and maybe it's their ankle, and a lot of that fractures in the feet. The ankles, they don't show up right away, even on X-ray. What you can do is you really give that a good hit, and you put it right on that area, and it kind of shakes up that area where that is injured. It might be fractured. If it's fractured, it's going to light them up. It's not going to feel good, but it's a really good screening method. Especially if somebody has a rib going on too. If someone, people sneeze, they can fracture a rib. This will light it up to the point where, yep, I think you should probably go to the medical you refer. It's better than them, than us going ahead and adjusting something that could be fractured. So that's something we really want to avoid. So it's a really good screening method. I do have one too that's meant for hearing. Doesn't have the big thing on the end here. You hit her and just put it behind the ear, and you can tell the difference. You can kind of test their hearing with that tuning fork. Let's go with these guys. All right, so we do other things besides adjusting. So these are meant for loosening up soft tissue, issues with muscles, connective tissue, things like that. This guy here, I'm just going to go through this one. I get a lot of people that come in that have some carpal tunnel symptoms, and so a lot of that is due to just chronic issues with scar tissue, wear and tear, things like that. And so what you can do is you put lotion on the area that's affected, and you can do this anywhere. I'm just using the wrist as an example, and you really work that area with this tool, and that helps to break up that soft tissue or that scar tissue in there. And it's gonna typically it turns right to the point of where it looks like a hickey, petechia. That's what it's called. And it may take 30 seconds. It may take 2 minutes, and you give it some time, have them come back in a few days, body's gotten rid of what we worked on, get it down a little bit. And so it will turn a lot better than that if it's done right. Some people don't have a tolerance for it, and so it may not work for them. They can't handle because it is a little intense, but it does really work on a lot of issues.
What is it for?
It just breaks up. You put lotion here for a lubricant on an area of the body that maybe, sometimes it's the shoulders and the neck, and I've done it on feet too, the bottom of feet, plantar fasciitis, and it breaks up a lot of the junk that's irritating things in there, and it can help long term to kind of calm down some of these issues and help people avoid, say, a surgery or something like that. It doesn't work every time, but it does really help a lot of the time. So that's another thing that I do. Last thing, I talked about auto accidents. So this crazy looking thing is designed for necks. And I'm gonna show you the picture real quick here. So most of the time we lose curve in our neck. We should have a curve that basically goes backwards, and most of the time we do a lot of forward head holding, where there's technology or too many pillows or driving or everything like that, so we tend to lose curve. This thing is designed to put it back in. Basically, you lay someone in there, And it's got a little inflatable bladder that they can blow up, and it helps to put the curve back in their neck. It's a traction unit in the traction family, and over time, with adjustment, it can help to permanently correct some of that curve. I used to do before and after x-rays, and with exercise, getting them a proper pillow, if they're doing all that stuff, I've seen it really change within about 6 weeks, which is kind of unheard of. So it's a really cool unit. And that's not just car accidents, but they really qualify pretty well because of the whiplash, typically the whiplash symptoms. But anybody with a reversal of the curve can benefit. So, any questions? I know I don't have much time, but
When you do one of the drops, what's actually happening in your body? What does it do?
if someone doesn't use a drop and they just put pressure and they push, you may hear a crack or a pop, and that's just gas. It's just air. It's not going on bone or anything like that. What the drop does, if someone just doesn't tolerate that very well, you are pushing on a certain area. It's just let's pick this guy right here. So I'm laying that person down. They're on the drop. I'm putting my pisiform, really specific spot on that area, and I push. And so what happens is that specific area, this drop is going to go down, and when it hits the bottom, the adjustment doesn't happen when I push, but when this thing hits the bottom is when the adjustment happens, because that piece wants to keep moving, because you put the energy into that piece, into that segment, or that joint. And so that's how the adjustment happens, because everything else kind of stops, and that one wants to keep moving a little because it's got more energy loaded into it. So it can really help to adjust larger joints too, like the pelvis, but even the small ones. Dr. Bob is a primarily Thompson adjuster. I use Thompson for the drops for the low back a lot of times, not as much for the mid and neck, but you can use it anywhere in the body. So even for the neck.
You said something about testing hearing?
Yep. Yeah. Some people. There's two types of hearing. There's conduction, bone conduction, and air conduction. So for the tuning fork, you put it on the bone, the mastoid back here, and if they have a hard time hearing more on one side than the other, then they'll raise. Can you hear? Can you not? Sometimes you can tell if there's an issue with the actual nerve in there, because, like I said, you got it could be a plugged ear or it could be a nerve issue. So if it's, if you stick it right next to their ear without touching the bone and they can't hear it, then maybe it's blocked with, wax or, infection, you never know. But it's just a way to differentiate between the two if you can't really see anything in there. Because sometimes the loss of hearing is completely nerve related. Maybe there's a lesion, maybe there's a tumor or something up in there that's, creating chaos with that nerve. So.
Okay.
You guys can ask me anything after you mean to. I know there's a lot of stuff here, so.
Very good. Let's do whatever.